last week on Wednesday. We were going through the different types of resistance. And on this slide, we're talking about variable resistance equipment. I just want to bring your attention again to this slide because it is important to know. And the definition of the variable resistance is that it matches the changing strength potential of the muscle throughout the range of motion. So, and we gave some examples, which would be resistance bands and exercise tubing. Those would be ones you'd probably use in your own classes or with your clients. Weightlifting chains, if the client is doing like a more hypertrophy or even into powerlifting to build more muscle and strength. And some of these actually machines, it depends on the type of machines you actually have available in your gym. So the ones you probably be using mostly would be these. So some of the pros, it can make you stronger throughout the range of motion, helps to strengthen through the weak points. Often those are your sticking points, right? But you know, so things can happen, right? Some of the cons. What are some of the cons with a band or with tubing?
It's slapping you in the face.
Exactly. I'm laughing because this actually happened and it's not fun. They can snap, they can break. So one of the things you have to be conscious about is, and always do this when you're using the equipment, especially bands and tubing, just give them a quick check over to make sure that there's no rips or tears. Because, you know, when they stretch it out, if there's a bit of a tear there, it can like literally rip and can cause some problems. So they're great, but just make sure that you do check them for safety reasons. And then, of course, what about chains? Are they quiet?
I was about to say they seem inconvenient to store, move, use, and have. Like,
Yeah, and I mean, some people really like them for training, but they can be really noisy, right? So that can be a con. And the other thing is too, when we talked about the machines, right? And we talked about, you know, helping to make you stronger in your weakest points, the way the machines are set up may not match your weakest and strongest points. So you know, that could be a con as well. And then we have our isokinetic resistance equipment. That's the pneumatic machines. At the rec, do you have any of those pneumatic machines?
No, I don't think so.
Yeah, and most facilities don't. Some of the older facilities do, but we don't see that too often and very much anymore in the fitness facilities around here for sure. But just remember the speed of movement is dictated by the machine. We talked about that before with isokinetic. Its speed of movement is dictated by the machine. I'm not going to go through this because it's not really something you need to know. All right, let's talk a little bit about weightlifting accessories. So I'm sure, you know, if you've worked at a gym or you've worked out, you may or may not at one point have used some of this type of equipment or accessories for weight training and probably would have some clients at some point using these as well. So let's just talk quickly about some of the pros and cons. What about for chalk? What are some of the pros for chalk and maybe cons?
some people do just get really sweaty hands, like disproportionately to the rest of society.
Mhm.
Could be a good thing for them to have around. It can be
Yeah,
messy
actually,
though.
chalk can be really great for lifting because it does help to give you a very good grip on the bars. The only, I guess, downside I can see really is the mess, right? So some gyms don't use it. Some gyms do. I used to go to a gym and they had a kind of a setup like this with the bucket and you could use the chalk, but it can get kind of
So
dirty.
I do know that nowadays they have liquid chalk, so
Yes,
it's
they
not
do.
really messy and it's
Yes, you
nice
can
to
use
have
it.
on your
Absolutely.
hands.
Yeah, there is liquid chalk. And the other thing I was going to just mention, if you're kind of communally using this, you're getting other people's sweat germs, whatever, right? So if you have your own liquid chalk that you can pop into a bag and then just put it on, I mean, that can be work as well. What about lifting straps?
Some people are allergic to chalk.
Oh, yeah, some people can be allergic to chalk, absolutely. Yeah. What about lifting straps? An example here. Anybody ever use these?
Every now and then.
Yeah, I have.
Yeah,
I use them.
Yeah.
yeah. And actually, you know what? They can really help. They can help you lift more weight, and can be very beneficial. But what are some of maybe the cons for using them?
You can like hurt your wrist.
You could, absolutely. If it's not used properly, some people don't wrap the strap correctly around the bar and it can come loose when they lift up. Another thing to think about is any type of equipment that you're using, whether it's like a lifting strap or gloves or anything, you can become dependent on those and may not develop the grip strength you would have otherwise, independent of using the straps or even the gloves or that type of thing. So it's something to think about. It can be beneficial, can be helpful, but if you're using it all the time, you might become, or your client might become dependent on it. And if they don't have it, they may not have that grip strength that they would have. Because remember what this is doing, it's actually helping support the lift of the bar rather than just having the grip, right? What about lifting gloves? Kind of the same thing. And you don't develop the calluses. So if you don't have the calluses, sometimes if you forget your gloves, all of a sudden you've got a lot of blisters on your hands. So there's pros and cons to it. The other thing is these gloves can get really dirty and sweaty, and so that you have to replace them quite frequently, because if you don't, they're pretty icky. What about weight belts? What are they meant to do?
Add another layer to support your core or your spine.
Yeah, so they help to stabilize the spine. And what kind of pressure are they creating? What's the name of it?
Intra-abdominal.
Intra-abdominal pressure. Yeah. So you might be able to, again, lift a little bit heavier, but we want to make sure we're not getting dependent on that, right? That if we don't have a weight belt, we can't lift the weight. So again, there's that give and take, I guess, the balance of using some of this equipment. And then we have this dip belt. So what are some of the pros?
If you want shorter rep ranges on your calisthenics for any reason, your pull-ups or dips.
Yeah.
Yeah,
So
we
it's
hear nothing, Doug.
Yeah, it's pretty easy to add extra resistance, right? So you literally are just hanging the weight off. What do you suppose might be a con? Like, is there a risk of injury somewhere? If you're especially for a dip belt?
Could unbalance you.
Yeah, and where could you potentially get hurt?
I think your lower back. When you
Yeah, definitely. There could be a risk of injury to the lower back, and it can just be uncomfortable, right? So that could be the con. I mean, there's always a risk to using any accessory, and there's some cons to it. But you know what? You have to make that decision for yourself or with your client to weigh that risk benefit, risk reward, I guess, and make the decision. But always remember, if you're using some of these things, you can become dependent, and it's good to train independent of that equipment as well at some time. All right, what about grip? So we've got a couple of different grips here. We've got an open grip and a closed grip. What is the difference?
The thumb?
The thumb, exactly. So which one do you think is going to be safer?
Closed.
Yeah, the closed, exactly. Because what could happen here? What could possibly happen? Could slip right out of their hands, right? So closed grip, it's the strongest grip. That's the one where your fingers are wrapped around the bar, thumb curls under the bar. And the open grip is when they, just the fingers, the thumb is kind of on the top. And you see people do this all the time. Sometimes, for example, even if they're doing lat pull down, they might just hook their hands on the bar. And they don't actually have a really good grip on it. So it could be easy to slip, right? And sometimes this is called a suicide grip because it's really easy for that bar to fall out of the hand if the grip isn't strong enough. So when you're training clients, that's one of the things you want to do is to make sure that they are using a closed grip. It's the safest way to do it. All right, so, and this is what we call a power position. So how would you describe a power position to your client?
A wide stance.
Yeah, so the feet are just pretty much both shoulder width apart. What's happening at the feet? What's going on with the toes?
Toes are pointed forward and knees are slightly bent.
Yeah, so the knees are slightly bent, not locked, right? The toes are for either forward or they could be slightly turned out, depending on the person's, the comfort for their stance. What's happening with the scapula?
Can't see them, but I bet they're retracted and depressed.
They are depressed and retracted. That's it. And what's going on with the spine?
Neutral.
Neutral. What's happening with the abdominals?
Contract.
Contracted, exactly. Exactly. You guys got it all. And the chest is lifted. So if you're giving direction to your client for your stance, it could be, let's stand with your feet shoulder width apart. Just keep a slight bend in your knee. We want to keep a little soft. We don't want to lock those. Keep those feet pointed forward, or you can just turn your toes out slightly, even up to 10 degrees. If we're looking at the chest, we want to roll those shoulders back and down. I'm going to squeeze those shoulder blades just slightly together, bring those together. Nice proud chest. And that should get them into a good power stance, a power position. I also call it an athletic stance. We want them to be in a strong and stable position, right? And when your feet are apart, you're more stable than when they're together. All right, let's talk quickly about spotter. So you may need a spotter. So you or your client may need a spotter if it's the first time they're doing the exercise, if they are lifting more weight than they did before, if they're maybe doing more reps than before, so they've upped the intensity. If it's a high risk exercise, so it could be something like a chest press with a lot of weight. You certainly want to make sure that they are supported. And any exercise that can cause you to drop the weight on your face or on your body. So those are all the criteria for having a spotter. And bench press with a bar should use a spotter. So for spotting, as a WT, as a PT, you're there for guidance and support. You're not there to lift the weight for them, right? So they're going to be doing the work. You're there to kind of guide them through the movement and be there as a support if they need extra support or help with the lift, right? But you're not actually doing the lifting for them. And you're there as a spotter to help prevent injury. Oh, and I should have added in here. Don't be too chatty, right? So you can have that discussion. We're going to talk about what you should be talking about with them before they lift, but you want to be focused. They should be focused. So we don't want to be carrying the conversation on. This is not the time to talk about what's going on in the day, right? So not being too chatty while we're doing that. So before they lift, what kind of questions might you ask?
If they've done that exercise before.
Yeah, absolutely. Have they done and have they done this weight before? Right? How many reps are they going to do? Right? So before they even start, they say, I'm going to do 3, I'm going to do 5. So you know how many to be prepared to help, right? How do you like to be spotted? Like where you're going to stand kind of more over them, standing back a little bit. Will they need a lift off? So if they're doing a bench press, for example, are you going to actually help them get the weight off the bar, or are they going to do that themselves? And how are you going to communicate that they need help, right? Will you tell me if you need help, or are you just going to start turning red in the face and you know, and then I'm supposed to understand that. So, you know, get the communication down for what the, you know, what to expect if they need assistance in the spotting. So some things to think about. You want to make sure they have a really good grip. You also want to make sure you can quickly grip if you need to, right? So you want to communicate exactly what you can do, right? So that's the other thing. Be honest with yourself and the person that's lifting the weight. Sometimes, you know, if the weight is a lot heavier than you would ever lift yourself or feel capable of, certainly let them know. And give them the option to have somebody else or have help, right? So you can have another spotter come if needed. And then also you've established your communication, what the verbal signal is going to be for help, but also maybe some nonverbal signals that you can establish as well. Again, being able to lift the weight yourself and get somebody else if needed. Stand in that power position or a split stance. So the power position again, the with the bent knee, feet shoulder width apart. But the split stance, you could have one foot forward and 1 foot back. So whatever makes sense for that particular exercise and for you as well, where you feel the strongest. The other thing you're going to want to do as a spotter is to make sure you keep your core nice and tight and your spine neutral. And then know where to hold the weight or the body part, right? So where your hands are going to go if you need to help. And we're going to talk about some of that in a minute, where that would be. All right, so for spotting, we don't want to stand too close. I mean, that can get pretty awkward because we are going to be in people's personal space. And depending if they're laying down on a bar, you know, we're pretty much really close to their head oftentimes. We also don't want to get in the way of moving parts. So if the bar is coming up and down, we don't want to be impeding that at all. We're not having a conversation most of the time, right? We're really letting them focus, especially if they want to focus on their breath work. And we really want to focus on any cues that they might be providing that they need assistance. And get to know your client because they're all going to be different, right? So let's look at how to spot a chest press. So we've got a couple of different versions. What are they doing with their hands?
One is supinated and the other one's pronated.
Yeah, so a lot of times if you're spotting, you can have one over and one under hand grip, right? That's very common. And that's just because it does tend to give you a little better grip. If one hand slips, you still have the other. You're going to position yourself in behind the bench. You want to be close enough that you can reach the bar, but not so close that you're going to impede, you know, anything that they're lifting. And I mean, as I said, like you're very close to where their head is, right? So you also want to have your nice stable stance, right? So, and then when they're at the top, obviously you're going to be standing up straight. As they're going a little lower, you are going to be bending. So you want to make sure you keep that back, nice and strong. And also, what would you be doing with your core?
Keeping it active.
Yeah, you want to keep that core nice and engaged, right? Nice and strong, because if you have to lift, you're going to be in a less powerful position because you're bent over, right? So you've got to keep this core nice and stable at the whole time. You want to keep your hands close to the bar without really touching. Now, maybe he's helping with the lift off or as he's putting it back, because normally you're not going to be having the bar, your hands right on the bar, but you want to have them so that you can quickly grab it if the lifter starts to struggle. What's happening with your eyes? Where should your eyes be if you're a spotter?
keeping an eye on them and their form, seeing what's happening.
Yeah, you're primarily going to be looking at the bar, see what's going on with that bar, right? And then you're going to be able to monitor and, and you also do want to check the form, right? If, and you might want to give a few cues, but normally you let them lift unless they're doing something that's going to imminently injure themselves. And then once they rack the weight, you probably give them some feedback at that point. Like if you feel they're arching their back too much or they're not, doing their breath work correctly, they're not exhaling with the push, that type of thing, you're going to want to wait till after they've racked it, then give them the feedback to do for the next time. Has anybody ever spotted?
Yeah.
Yeah.
Yeah. Yes.
Yeah. And how comfortable do you feel doing it?
Good.
Good.
Yeah, very.
Awesome.
Kind of the weight.
Depends on the weight. That's a good one.
Yeah.
And I mean, and like I said, if you ever feel uncomfortable and you don't feel like, this is a weight you feel like you could lift or be comfortable with, absolutely let them know, or, get assistance from another person at the gym or somebody that's, confident with the weight, right? So it's better to be safe than sorry, put it that way. All right, so how do we spot a dumbbell chest press? So where are we standing? We're standing in behind the lifter. So they're laying on the bench. You're going to be in behind the lifter. You want to, again, be close enough to assist, but not so close that you're going to interfere with their movement. Where are you want to be in that power stance, right? So feet are shoulder width, and that helps you maintain stability. So that's you. Where are your hands going to be?
Could press from under the elbow to if you're just helping them finish, but not so much if you really need to get the weights out of their hands,
So the FLC guidelines is that we actually do support at the wrist
Okay.
and not at the elbow or the dumbbell. So we're not latching onto the weight. We're not lifting from there. And one of the reasons is if you put your hands under somebody's elbow and you go to lift them up, they might go like this if their arms aren't straight.
Sure.
Right? So it's better to actually grab around the wrist. You can help lift. And what you can do, for example, is if you want to, say if they want to increase their weight, but they're not really strong enough on the press, right? You can allow them to do the eccentric, and then you can help them with the press, right? So that can help them get stronger. So again, position behind the lifter. We're going to have a nice stable stance. We're going to grab around the wrist, a hand position around the wrist. That is the FLC standard. People do other things, but just for your own knowledge, that is the FLC standard. And you're going to still do establish the clear signals, right? Tell me when you need support. Now, most of the time you're going to know because they're going to start straining, right? And then the arms start to shake and maybe they only get up so far, right? They get to that sticking point and they're not getting any farther. So then you can say, oh, come in, I'm going to give you a hand, get them up. So that might be, that might be their last rep. Or if they want to do some of the eccentric loading, we're not doing that with beginners, right? But they want to do some of that eccentric loading, you can do that and then help them with that concentric or that press, right? For one or two more. But that's something you have to communicate with your client and establish beforehand, right? This is the type of training you're going to be doing. And then again, as somebody mentioned last time, you always want to be monitoring for their form and for their movement, and then be prepared to assist if necessary. Any questions on that?
No.
Okay. And I already asked, have you ever spotted? So any stories anybody wants to share? Any challenges, or do you enjoy spotting?
I'm still uncomfortable with it.
Okay. And I mean, is it something you'd like to work on, or is it, and you actually don't have to as a trainer. If there's certain things that if you don't feel comfortable spotting, you can always get somebody else to help if they're doing something, especially heavier. But with the lighter weights, you should practice and
Yeah.
get comfortable, right?
I think, well, a guy asked me like a week or two ago, he was doing an incline dumbbell press with the hundreds.
Oh my goodness.
I'm the only, like, there's plenty of big guys in the gym. He comes up to me, can you spot me? I said, well, I don't even know how to spot this exercise, first of all. Also, that's a lot of weight. He said, I don't think, and I said, why don't you just ask one of the guys? He's like, no, no, no. He's like, I really just need somebody there to watch me or whatever. And like, I had no idea. I didn't know where to put my hands. I couldn't even reach under his elbows, like, because of the incline of the bench. So I don't know how you would spot the incline dumbbell bench, I guess. You would still put your hands like,
You would still, well, you'd come right up behind them because the bench is at an angle, right?
it's at an angle, but like their head's not at the top of the bench because the benches are so big. So they're kind of like further ahead. So you can't really get underneath their
Yeah.
hands as easily.
Yeah. And you know what? That's something that when we do our in-person date, we can try and see what would work. But we don't recommend putting your hands under the elbow because it could go under, they could go forward. I mean, and you were right to tell them like you should get somebody else to do this. Was it because were you working out or were you actually working in the gym and they were asking for your help because you were working in the gym?
No, I was just working out that day.
Oh, yeah. I recommend just, sorry, I can't help you. Because the other thing that could happen is you could get hurt. Because what happens if they drop the weight and that goes on your foot? You know what I mean? Like, or falls back. I mean, anything can happen, right? If he lost his grip. So yeah. Get comfortable with saying no. Because sometimes you just gotta say no. But then you can have some really great experiences spotting someone if you feel comfortable doing it. They get a personal best. I mean, that's amazing. It's amazing to be part of. So it is a skill. It's something that you need to practice. And again, you just know your limitations and know when to say no or know when to say, you know what, you need somebody else or we need to have somebody else to help because I can't lift that weight. And they shouldn't put you in that position because that you can get injured as well, right? So
I had one question about the whole spotting thing, which is
sure.
that, like in where I live in our gym, like I have to say, like the other day was the first day I've been in our gym here because I just lift a small amount of weight at
Mhm.
home. I just haven't been doing much of anything.
Mhm.
But lots of times in the gym, like you're saying, there's all these exercises that, that you should have a spotter for. But there will be times, I just know from walking by our gym that there's plenty of times that there is nobody in the gym but the one person, whoever's doing their exercises. And the gym does not always have someone, definitely doesn't often have someone that's in there
Mhm.
that's working in the gym itself.
Right.
So like, what is protocol for that as someone, that is in the gym? I mean, it's not really, it's not optimal, but the other choice is not to do,
The exercise. Yeah. So are you asking from the trainer's perspective or just somebody being?
Well, just like, I guess a little bit of both, because if you were in there as
Mhm.
a trainer and for, a particular person or something
Mhm.
like that, you had your client there and you saw other people and probably they've been in the gym for, many times doing
Mhm.
say a bench press without any spotter because they're in there when there's nobody else there. So,
Yeah.
is there, I don't know, it seems like,
I mean, if it's not your client, it's just somebody that's working out of the gym, that's their prerogative. If they want to work without a spotter, it's just, if they do get into trouble and there's nobody there to help them, that is their decision. And it would be up to the manager at that point to decide if, if there's an ongoing issue. But normally if you're working with a client, you stay with your client. You're not going off to help somebody else in the gym. So you're not, unless there's like an imminent injury, like somebody dropped the bar on their chest or something and they're, you know, they can't breathe. Obviously, you're going to go and assist them, but if they're just doing their exercise, you would not leave your client. You stay with your client. If you are working with a client, and they are stronger, than you are, and they can lift more weight than you can, then if there's certain exercises that they want to do, then you would have to ensure that you had somebody there to help. And if you don't, then you would just have to cancel them. We're going to do something else today. Because you don't want to be liable for them injuring themselves because you can't properly spot a certain weight. Does that make sense?
Yeah.
Okay,
Okay, thank you.
you're welcome. All right, so we've talked about spotting and again, this, as you go forward, you're going to have different scenarios happen, and just always remember, understand your own limitations, understand the limitations of your client, and what your responsibility is, right? So it's to your client, and their safety. Okay, so let's switch gears. We're going to so now we're actually going into our client session, right? So at this point, we're talking more of the one-on-one than doing a class. So for your client, just the same as all your class components, what are the 5 things typically that you want to include in a program, in any session? What's the first thing we do? We warm up, right? What are some of the other things that you might include?
Cardio,
Cardio,
weight training,
weight training, and what's the other ones?
flexibility.
Flexibility and then and cool down, right? So those are the components that we want to consider when we're putting a program together. So when you're putting this program together for a client, you actually have a couple of different options, which is kind of nice. So you can do a full body warm up, on some cardio equipment. So they might come in a little bit early and say, you know what, do 5 or 10 minutes on a treadmill, elliptical. And what do we want to get them to do when they warm up? What's happening with the body?
Increases temperature,
Yeah.
increases alertness, and
What's happening with the heart?
increasing.
Increasing
Yeah, heart rate's going up. We're warming the muscles. What's happening at the joint?
the sinus.
Yeah, the synovial fluid
Yeah, synovial fluid.
it's lubricating everything, right? So we're getting our body ready to work out. But you have that option, so they can go and do something on cardio, or you can actually get them to do some light weights. So, and when I say lightweight, something that's maybe 50% of their 1 rep max, doing some reps for warm up. You could even do body weight. So you might do, for example, if it's going to work lower body, you can get them to do body weight squats, and that add in some light weight. So almost like your warm up weights, we call it, and then before you go to your working weights. So you have some different options. The whole idea here is we want to make sure that their body is prepared to start the workout. It's not unusual to see people come in right off the street, drop their bag, go to their first piece of equipment and start working out. And that just opens yourself up to, lots of potential injury because the muscles may not be warmed up, especially if it's a cooler day or if it's in the wintertime. So we always want to make sure that they're warming up. The thing is, if you have limited time with them. So if they come in and they do their warm up with you, that's going to limit the amount of time you have for the actual workout. So it depends on how you want to structure your workout and for them, and also what they have, comfort for. Maybe they like you to be there when they're doing their warm up. What are some of the things you can actually do if they're doing a warm up on a treadmill or an elliptical? As the trainer, what can you be doing?
You could either be setting up equipment and preparing the space, or checking in a little bit on how they've been eating, how they've been doing, how they've been sleeping, etc.
Yeah.
Yeah.
I really like the idea of checking in with them. This could be a great opportunity to go over. Now, where would we want to stand if possible?
In front of them.
Yes, if you can get in front of the equipment, that's great. And because we don't want them, like if you're standing to their side, then they're going to have to turn, right? And that can throw them off balance. So if you can stand in front and you can have that conversation, it's a great way to reconnect with your client every time they come in. Hi, how you doing? How was your week? Tell me what's going on. Do you have any, soreness or anything from last time? Do you have any questions about what we've been doing in our workout? So this is a great opportunity to have that conversation, because remember, they're just warming up, so they shouldn't be out of breath, right? So they should be able to carry on that conversation. One word of advice, we had one of our members walk around the front to talk to the client and accidentally hit the off button on the treadmill, and the treadmill stopped really suddenly and the client was thrown back. So just be very cautious if you're walking around any equipment that you're not accidentally like knocking out the power or hitting a power button or something, turning things off. And again, I mentioned about that you can do the 50% of the 1 rep max. Could be body weight, could be just warm up weight, just preparing the body for the exercise ahead before you get into your working weight. So then if you're planning those exercise programs, so we go back to FIT, right? We go back to our FIT principle, that you're going to use that as a guide for pretty much everything you do. When you create your plans for your clients, when you create your classes, it's all the FIT principle. You're going to use it for everything. So how would you, consider it we'll look at endurance, hypertrophy, strength, or power. So for endurance, what would, if you're looking at a single session, right? So what would be the intensity? Would you use a heavier weight or a lighter weight?
Lighter weight.
Lighter weight. And what about the number of reps?
Higher reps.
A lot higher reps. What would the range be?
Up to 15.
Yeah, so for endurance, it could go even 12 to 20, right? It can go quite high. And you could use any free weights, that type of thing. What about for hypertrophy?
Getting a little heavier, getting into slightly smaller rep ranges, but still, 8 to 12.
Yeah, so you're kind of in that medium intensity, right? So let's take a look at, for endurance, how frequently could you do those sessions?
3 to 6 a week, I believe.
Yeah, because it's not as intense, so you don't need as long as recovery. Even in between sets, you don't need as long a recovery. I'm going to talk about what that is in a few minutes. But if you're just doing endurance, you can literally, you could do 3, 4, 5 times a week, even 6 times a week. 6 might be a little much when you're first starting out, but the idea is it doesn't challenge your body as much, so you don't need as much rest and recovery, right? For hypertrophy, it's becoming a little bit more intense. So how frequent might our workouts be if we're aiming for hypertrophy?
I'd still say 3 to 6, but 6 is like you're becoming a pretty advanced bodybuilder at that point. You're getting pretty dang.
Yeah, so it's going to be less than endurance, and you're probably starting to think about split routines, right? Because you're going to need to have a little bit longer rest and recovery time, and then same with strength and power. So the more weight you do, because it becomes more intense, closer to your 1 rep max, you're going to need more recovery. So you're going to do less workouts for that particular body part, but that's when, again, you're going to probably get into more split routines. And we talked about volume, and volume, again, is just how hard that you exercise. And we had an example of that earlier. We have another one here. But essentially, if we want to build muscle, volume is the most important thing. And volume is just that load, which is the amount of weight we're lifting, the number of repetitions that we're doing, and the number of sets. which is set as a group of consecutive reps. And just an example we have here, the volume is the weight times the reps times the sets. If we're talking about a leg press, maybe someone's pressing 300 pounds, they're doing 12 reps for 4 sets. We literally just calculated out, they've just pressed 14,400 pounds. I'll tell you, your clients will love it if you can tell them how much weight they press, because they just feel like they've done and accomplished so much. So when you are, the one thing you want to make sure you're doing as they're working out is to always record what their weights were, how many reps they did, how many sets they did. You're setting that out. You have that established as a program, but it can be tweaked along the way. Sometimes they're able to do more, sometimes they're not. So you got to capture all that information. But what you want to do eventually is to establish that pattern, then be able to show them their progress, right? Because that's what you should be doing as their trainer, is helping them make their gains and obtain their goals. So I found for a lot of people, they just love to know how much weight they've lifted or how much they've pressed or pushed. And it just gives them that sense of accomplishment, especially if they can compare it to maybe, 2 months ago and look what you're doing now. So you're showing your value as a trainer that they're able to increase their ability, right? So one thing we do have here, and it has some stars. So we want to start slowly. So as we're creating their programs, for most lifters, especially if they're just beginners, we start with more of an endurance-based program, and then we gradually shift them depending on what their goals are, if it's to gain muscle or strength. And those two really go hand in hand. Then you're just going to gradually increase the weight and lower the reps. You want to always make sure you're allowing for enough recovery. We're going to talk about what that looks like in a minute. And always think that muscle strength and muscle endurance are developed independently of one another. So you can sort of do some cross training, but depending on their goals, if it's muscular endurance, you're primarily going to keep the weights a little lighter, but they're going to be doing a lot more repetitions and sets. And if they're really looking to develop strength and power, then you're going to keep the weights heavier and lower reps. They develop independently of one another. All right, so we already talked a little bit about, and you guys should know this from ET. And endurance is the ability of that muscle to make the repeated contractions against resistance, and that's why we talk about the reps are higher, they're 12 to 20. We want to keep the lower weight. Sometimes it's referred to as dynamic strength. And again, this is really great for beginners because it gives them the option to learn the form before adding the weights. Super important. We don't want to put a lot of weight in people's hands or get them to try to move a lot of weight before they get the form down, because they can really hurt themselves. So when you're first starting off, body weight can be great until they learn the form. Start adding lower weights. And then they're going to start to see, typically they'll start to see gains fairly quickly. They're able to move up in weight fairly quickly. What is the one big reason for that?
Neurological adaptation or
Absolutely. It's that mind-muscle connection that they establish, their neurological adaptations. And is there any difference between male and female for that?
No.
No. Neurological adaptations are the same for males or females. They can both have those gains. All right. And if you're working, depending on the person now, when you're creating these programs, depending on the person, how frequently they're coming, you might be spending, 4 to 6 months in that endurance phase. And that's okay, because they're going to really learn the form. They can start to build their strength and their weight. Some people might be ready a lot earlier than that. So every single client is different, but it's okay if they stay with the higher weights. What would be one group that you probably might stay with the lighter weights and higher reps? Demographic.
Older
Yeah,
adults.
there is, yeah.
Older adults, yeah. Not to say they can't lift heavy. If that's something they want to do, and that you can gradually get them to do that, absolutely. If you feel that they're capable of doing that. Of course, you want to, moderate as you're going, but primarily most of them will probably be training more in functional training and more in endurance, right? So, and then if we are making changes, so we've got this program, we see progress, we want to help them continue on, because we want to look at which principle primarily to make the progress.
Progressive overload.
Progressive overload, exactly. So we want to, we need to have some type of an overload if we're going to see progress and change, right? So the thing to remember is to only change one variable at a time. And everybody tends to think about, oh, I'm going to add more weight, right? But you can have the same weight, but start adding extra reps. So maybe if you've been working with 10 reps, go to 12, go to 15. Once they can do 15, add more weight, right? And then you're back down to 10. You can also add more sets. So when you first start, you might only have 1 or 2 sets for each exercise. And then as they get stronger, you can are able to do that. Then you can add an extra set. You might go up to 4 sets, right? So you can add extra sets, keep the weights the same, reps the same, add an extra set. Or you can add extra, get them to up the weight a little bit, increase the overload, or you can decrease the rest time in between. So for example, if they're used to doing a set and then hanging around for a minute before they do the next set, maybe take it down to 45 seconds or 30 seconds, right? So you can make the exercise more intense by changing any one of those variables, but the idea is to just change one at a time. So if they're doing really well, so yeah, we're going to add extra weight and we're going to do some more reps and another set, and we're going to cut down your rest. That's a little bit too much at one time, right? So choose one and make the change, and then maybe the next workout you can change something else. All right, so then we have hypertrophy. So we're building muscle size, and we always recommend, especially for people that want to get stronger, the best thing they can do first is to build muscle. And why is that? It's right on there.
That carries heavier loads.
Yeah, it gives you greater force potential, and force potential is what gives you the power, right? So typically, larger muscles have a greater force potential. They have more power and more strength, right? So if their aim is to get stronger, then building muscle prior to that makes a lot of sense. You build your muscle, you build your strength, right? You have better pores. And then in order to do that, we're using kind of moderate reps, moderate to high intensity loads, right? So you might be working in that 70, 80, 85% of your 1 rep max. And then you may go into split routine. So why would that be?
So you have a rest day for.
Yeah. Allows for that rest and recovery, because remember, now we're getting into that more, moderate to high intensity, which means your body's going to take a little longer to recover than it would for endurance, right? So you probably wouldn't want to do legs 3 times a week. Maybe you might do legs twice a week in between. But remember what we said about hypertrophy. What do you need for hypertrophy, right? Best way to grow muscles is through higher volume. So you still need to be able to do those workouts. So by doing split routine, you could do leg one day, maybe upper body, maybe it could be chest, maybe it could be back the next day. So you can split everything out. So you're still working all these body parts, so when you're doing chest, you're not working your legs, right? So you can work really hard in the chest, the next day maybe work really hard in the back, then the legs. It allows you to focus, build, and still get that rest and recovery time in. Make sense? And still get all that volume. All right, and then we have muscular strength. So that is defined as the max force a muscle can exert for a single all-out effort or 1 rep max. So for muscular strength, we are working closer to our 1 rep max. So we might be, 3 to 5 reps. We might be 2 or 3 reps. We're getting really, really close. So high weight, low reps, done using full body routines. So the most important factor for developing strength, amount of resistance, and the total number of reps. Again, it's all down to volume, right? It's volume for building muscle, and it's volume and for muscular strength. And then we have power, and power is pretty much training at your 1 rep max, right? So if you were training for power, what would your rest in between the sets look like?
Like 3-4 minutes.
Yeah, it even can be 5 minutes. Because what energy system are we using for a 1 rep max?
Fast.
The-
The ATP-CP, right? And it literally, it's gone, right? That 1 rep max probably burns it right out. So it does take some time for that to reset, right? So that's why we typically have to take a longer period of time to rest in between, is to allow for that ATP-CP to replenish before we go again. So the closer that you train to your 1 rep max, the longer the rest period. So, and we're going to talk about what those are. Okay, so guidelines for exercise depending on the goal. And this is based again on the FLC standards. It's not like absolute, right? But these are guidelines and ranges that you can work with. If you're working with a client and, if, for example, they're working on muscular hypertrophy and it's saying a range could be anywhere from 30 to 90 seconds. Some people, depending on what percentage, if they're closer to that 85%, they maybe need that entire 90 seconds, right? If they're at 60, you might only need 30. So, you can communicate with your client to see, are you ready to go back? You can ask them. So you can either say, we're going to take 30 seconds, or you can say, are you ready to go back, or do you need some more time, right? So they should be able to tell you how prepared they are for the next set. So let's look for muscular endurance. So frequency, you can do 2 to 6 days per week. The intensity is anywhere between 40 to 70%. With 40, that's kind of at our warm, 30 to 40%, we're more at a low intensity, almost warm up kind of range. And then as they get a little, their form is good and they're seeing gains or increases, they might be going up closer to that 70%. And that's typically 70% is about 12 reps. 70% of the 1 rep max is about 12 reps. For muscular endurance, they could be doing 1 to 3 sets. Again, if they're only doing 1 set, it's probably because they're a beginner. And we're just starting to, get their form. We don't want them to be sore. And then they're gradually going to increase till they can do 3 sets or even 4 sets, right? And the reps are going to be higher, and because the weight's lower. So there's always that inverse relationship. When you have higher reps, you're going to have lower weights. Vice versa. If you have higher weights, you're going to have lower reps. The rest in between sets is probably, could be around 30 seconds, could be even less. If you're doing a class, for example, and you're doing some type of hit, you might have it timed out that they're doing 45 seconds of work and maybe they're doing 20 seconds of rest or something. So that shortened rest time becomes the intensity variable, right? And then the rest in between workouts, so the the opportunity for the body to recover, the recovery principle, right? That's when you make your gains during the recovery and your body is recovering from the workout. Is somewhere between 24 to 48 hours. So depending on the intensity, if you are, 40 or 50% of your 1 rep max, you can probably go and work out again the next day, right? Because the intensity is not that high. If at any time anybody has a question about any of this, please, ask. All right, so then we have our hypertrophy. So now we're, 2 to 4 days per week. And then, and you could even do more. So again, if people who are really into bodybuilding, they might go 5 or 6 days a week, but that's when you get into those split routines, right? And with hypertrophy, the whole idea is we want to build muscle. And we are doing that by, we have moderate amount of reps, and we are a little closer to the 1 rep max, somewhere between, 60 to 85. And again, that 70% is about 12 reps. So sometimes you could be doing lighter weights with lighter intensity, and that could be for accessory work for some of the smaller muscles. And then for the bigger muscles, you might be working closer to the 1 rep max, maybe, 80, 85% of the 1 rep max. You might do 1 to 5 sets, depending on the body part and the intensity of the effort. And then rest in between sets. It's going to be a little bit longer, obviously, because you need more recovery time. Primarily, what energy system are we going to be working with in hypertrophy?
Lactic acid?
Yeah, exactly. So that anaerobic lactic acid system, that's where we're going to primarily be working, because that's coinciding with that with the number of reps that we're doing and for how long. And usually you're probably 30 seconds to a minute doing those reps, depending on the exercises. So that falls within that lactic acid energy system. And then the rest in between the workouts. So because the intensity's gone up a little bit, that just means we're going to have to recover a little longer, right? So again, that's where the split routines come in. So if they do want to come in the next day and they did legs one day, they could do chest another day, back, however you split it out. But allowing that particular body parts or muscle groups that they've been working to get at least 48 hours of recovery time. What happens if you don't? What happens if they just keep coming back and they're working the same muscle groups?
No.
They won't see any gains because they can't recover because they
Yeah.
anabolic recovery.
So, I mean, there's all kinds of things that could happen. Obviously they could be in pain. They're not going to see the benefits because they're not getting the gains because they don't have the recovery. They could get into the situation where they're almost like overtraining. And then they get all the issues from overtraining and the fatigue and issues with their immune system and so on and so forth. So it really is crucial to balance it out. If you're putting their program together and they want to come frequently, make sure you're doing that split type. And then we have strength. Again, frequency is down a little bit, 2 to 3 days per week, maybe. They're getting closer to the higher, the 1 rep max. The sets can go anywhere from 1 to 6, and it's because maybe if you're doing 95% of your 1 rep max and you're only doing 2 reps, so you might have to do 5 or 6 sets, right? Because again, we still need the volume. And then of course, the closer to 1 rep max, you're going to be doing a much longer rest time, could be up to 5 minutes. And then, so and then they're going rest in between workouts, 48 to 96 hours. So, 2 to 3 days in between workouts for those particular muscle groups. What are they doing in this 1 to 4 minute, 5 minutes, or 30 to 90 seconds? Are they sitting around?
Having a drink, maybe having a chat.
Do we want them to sit?
No.
No.
No. And that's the thing. A lot of times people will sit automatically. They're, especially if they're giving it an all-out effort, and then they'll go sit. What could possibly happen with that?
Pooling?
The venous pooling. Yeah. Especially if they're really lifting heavy and, their breath rates increase, they've done that intra-abdominal pressure, yeah, so we want to be mindful of that. And sometimes you can come up with some ideas for active rest. What would an active rest be?
Like a little bit of joint mobilization or something to just.
Yeah, because you know what? Here's the thing, like their muscles are nice and warm now, probably, right? So they could do some stretching. right? They could do, maybe they do some abdominal, right? Like you could do a couple of different things, sort of an active rest, rather than have them just sit. Now, depending on how close to their 1 rep max, if they're like totally burnt out after, they maybe just walk around a little bit. But you can get them to be active in between and do some different activities. Stretching is great in between their activities. So that's something to think about, though. What are you going to get them to do? All right, and then here's the guidelines for training with more than one objective. So most of the time, people are going to come in and train. They're not going to say, I just, I want to have strength. Well, if they want to have strength, we know what? They got to grow their muscles. So we're going to have to play around with that a little bit. So if it's more of an endurance thing for them, we know we're going to be at this percentage of the 1 rep max. We're going to keep our reps higher. And then endurance with some muscle. So you can just kind of go down the scale. So you can play with that as a trainer, as you're putting your client's program together, kind of see what their goals are, and then start to put together the program that makes the most sense, right? Where they're going to be in reps, where they're going to be at percentage of 1 rep max. What is the qualifying factor for all of this?
Results
With the-
might vary based on the individual.
Yes, and where they are in their journey, right? Because somebody might come in and say, I really want to build muscle and I want to be a power lifter. I want to be really strong, but they've never lifted weights before and they have no muscle tone. So it's like, okay, well, you know what? That's fabulous. We're going to get you there, but we got to start down here first, right? We're going to work our way up there, but we got to start here first. So start where they're at. We'll, work towards the goals to get them there, but as long as they're putting the work in, but always think to start where they're at. So even though their goal might be, oh, I want strength, we're not going to start them off here, right? Because they don't have the ability to do that.
I have
So,
sorry.
so go ahead.
Are there any like exercises that you would say you should always keep within a certain rep range? Like you should never do sets of 1 to 5 for lateral raises or something? Or is there like a certain
Well, so lateral raises, I would say would be more like an endurance type. We're strengthening some of the accessory muscles like the medial delt, right? It's not a huge muscle. We want to strengthen it. And remember, one of the rotator cuffs, the supraspinatus, it
Right.
raises, 15%. So like those types of exercises we're going to probably keep into the lighter, right? 'Cause
Okay.
We don't want
You
to.
can still create hypertrophy doing sets of 10
Oh,
or
absolutely. Yeah,
15,
8 to 12, hypertrophy 8 to 12. So even if you're doing, 12, you're still going to get some benefit from it. And you can gradually add weight. The problem with that most people run into is they increase the weight too quickly, or they
Mhm.
start with a weight that's too heavy. And if you're working a lot of these smaller muscles or accessory muscles, you've got to be very careful and gradually build up, right?
Right.
So that
Okay.
was a great question. Thank you for that.
Could I ask a quick question? Is
Sure.
there any pros or cons to, again, if you had a moderate, a non-beginner client, to doing like mixed sets where you might have one at a lower weight that was for endurance and then have their second of 3 sets shoot up and be a little bit of a heavier set and then come back down? I know you would get less of each individual result, right? Like you would be splitting your effort, but is there any other concerns there or?
You know what? If they have the ability to do that, it's kind of like a pyramid set.
Yeah,
So like they start here, they go up there, they come down, and there's lots of different strategies you can use. It's also called muscle confusion. So the other part of that is like people get, our bodies adapt, right? And so when you throw something like that at the body, it gets confused. Like, okay, I'm used to doing that. Now I'm doing this. Right? So the muscle has to adapt. The body has to adapt. So yeah, absolutely. It's a great way to make some gains. Like when we're first starting off with our clients, we're going to be primarily in some basic programs, right? We just want to get them to a certain stage. But then when we get them to a certain stage, in order to see progress, we got to challenge them, right? Progressive overload. And so doing those types of strategies, like I mentioned the German volume training the last time, there's lots of different things that you can use with your clients, especially to help break through a plateau. Those types of things are very helpful. So yeah, we're going to talk a little bit about some of the different programs you can use. And as you start to work with clients, I would really encourage you to go and do some research and find out about these different programs, and then you can try them with yourself, do them yourself, but you might want to try them with some of your clients to see what kind of results that you can get from it. I'll tell you, I swear by the German volume training. It does really build strength, but that's just one style of training. That's just one program. There's so many different ways you can train people. It's amazing. All right, so this is the big question that a lot of people have, is how do you determine training loads, right? So how do you know how much weight to use? Any thoughts on that?
I think you can hear a little bit about what they've done,
Mhm.
take a look at their size and make a rough estimate, and always err deeply on the side of caution, because it's way easier to add more than it is to, pick someone up off the ground.
Yeah, and here's the big thing. It's guesswork, right? There's no magic formula that's going to come out with the best weight for every client. It's guesswork, and it's your experience. And always, as you mentioned, err on the side of caution, right? So if someone says, oh yeah, I go to the gym and I can, bench press like 100 pounds. Okay, let's start with 50. Right? And then gauge from that, because people tend to they exaggerate their ability, or they might be thinking, oh, I could do that. I did that 20 years ago. Yeah, I used to bench press, whatever. I used to squat, whatever, right? So let's start, we'll start low. We'll start 50%, we'll start 40%, we'll start really light, and then we'll gauge from there, right? So it is guessing. It's a trial and error method, right? And for the most part, you'll get really good at this, right? It is quick and accurate, and it really does depend on the trainer's experience. So the more experience you have using this, the better you're going to get at it, and it's not intimidating, right? So choose a weight that you feel your client is capable of lifting for, say, 12 to 15 times. And then, so do a warm up, right? So do a warm up. You can do that even with the 50% of their test weight. So say, oh, I can do a dumbbell chest press with 10-pound dumbbells. So we're going to do their warm up weight with 5-pound dumbbells. We'll get them do their warm up weight, and then we're going to go to the working weight with the 10 pounds. And we'll see how many reps they can get with good form, right? And so after they do the 10 rep warm up, we'll give them, they can do a little rest, and then we're going to get them to do the chest weight. Now, said rest for 2 minutes. I don't think it's necessary. You might rest for 30 seconds, 45 seconds, because remember, it's just in between the rest in between sets, and then perform that test weight. Do 12 reps, and then there is a chart that you can use. It's on the next slide, I believe, to determine if this is a good starting weight. But one of the things that I do, so maybe you don't have a chart with you, right? Maybe you don't have that chart. How do you determine it? You can ask the client, and I use the scale 1 to 10 because it's really easy to use with them, and just ask them on a scale of 1 to 10, with 1 being super easy and 10 being so hard, I couldn't do another one if I tried. Where would you put that weight? And most of the time they're going to come back and say, oh, it was like a 5 or a 6 or a 7. And that's kind of the range you want them to be in. So they're kind of quantifying for you, how difficult that they felt that weight is. So that's one way to do it. Or you can use a chart. So whatever works best for you. So, and then again, that's the rate of perceived exertion, what I just talked about, how many reps they can do. And then the chart on the next page. So this chart is also in your book. What do you think would be easiest to use? Like if you were going to be when you work with your clients?
Probably the RP.
Yeah, you know what? It's again, because then you're getting that feedback. So when you rely on a chart, it's kind of giving you the average of what most people could do, but really we want to individualize it to that person, right? So it's just like, how challenging did you feel that was for you, right? And they give you the feedback and then you make the changes accordingly. You might put the weight up, you might take the weight down. But I find that's usually the easiest and also the most personal, right? I don't even know how to pronounce that. The Backel-Groves chart. It's really good for those larger muscles and for the big compound exercises like the bench press or the squats, but not so good for some of the smaller exercises. So that's why I find the RP is really the best way to go. And this is in your book, right? So you can go through, but RPE, you can't go wrong. And you're keeping up the communication, right? So, all right. So 1 rep max. Again, we know it's the amount of force that a muscle or a muscle group can generate in that single rep, and it is calculated by all kinds of different formulas. It often results in acute onset muscle soreness, and DOMS, right? So we're not using it for beginners. It has a high risk of injury if you don't get it right. So, that 1 rep max for like power lifters and people that are really experienced, but chances are you're not going to use that with your clients. So, how do we then determine, where, how many reps that they should be doing? So we started off, we gave them like kind of a guesstimate weight, right? We started off with the warm-up weight, 50% of that guesstimate weight, and then we got them to lift it. We got their feedback. They could do 12 reps and it was really easy. So maybe we had to take the weight up, or maybe they couldn't get to the 12 reps. They were really struggling. So we're going to take the weight down. But how do we determine the intensity? Well, it's based on how close we can get to the 1 rep max, how many reps you can get. So in this chart, just kind of lays it out. If you're doing endurance, we're, anywhere 13 to 20, and that kind of quantifies how close it is to the 1 rep max. I mentioned before, 12 reps is about 70% of your 1 rep max. 8 reps, so if you're doing strength and hypertrophy, you're in that, 78 to 83 percent of 1 rep max, and then it's just pure strength. And then of course this would be power. These ones would be power. You're 85% and above. So most of the time with most of your clients, when you first start off, you're going to be here. You're gradually going to take them over to here. They're going to probably most of the time work somewhere in here, right? So they're going to be anywhere between like the 6 and 12. And that will give them, strength and also hypertrophy. Any questions on this chart? So the way you can think about it is that, if they can do 12 reps, and of course the 12th rep should be a little more challenging than the first, they're working at 70% of their 1 rep max. And then you can literally figure out what that 1 rep max would be for them. It's on a chart, and I think it's on the next. Yeah, the prediction chart. Let's go through it. So it's in your book on page 73. Let's just bring it up. Is this slide? I thought this slide was here. Oh, there it is. Okay. So this is your training load for the 1 rep max. So say they were doing 12 reps at 70%, and they were lifting 20 pounds. So based on that, their 1 rep max would be 30. And that could be in either pounds or kilograms. If they were able to lift 60 pounds, then we can guess that their 1 rep max would be 90. So this chart is just a prediction. It's an estimate. It's not written in stone, but it's a good way to think about, okay, what would their 1 rep max be? But you can also use a chart like this to think about, okay, well, if they want to gain strength, so up here, we're kind of in the endurance range, right? We're in the endurance range here, but what kind of weight do we want to lift if they want to get closer to their 1 rep max, but we're working in that strength and hypertrophy range, right? So we want to be working up towards this way. So it kind of gives you a goal weight, I guess, to work towards. But again, you're not going to be working in this 1 rep max range, and you probably are not going to be in here for the most part, unless you really gain experience if you're working with power lifters, right? So that 1 rep max training load prediction chart is on in your book on page 73. All right, so muscle force velocity relationship. Well, we talked about momentum when exercising. I think there was a slide there we had with the kettlebell. So one of the things with momentum and kind of plays into common errors that you see with people in weightlifting is that they're going too fast, right? So slower is better. And we always talk about time under tension for the muscle, or TUT, right? So that refers to the amount of time that a muscle is held under tension during exercise. And for an optimal duration of TUT for an increase in maximum strength is somewhere between 4 to 20 seconds per repetition. So if you're thinking about, like, for a bicep curl, right, that could be an count of 2 going up and a count of 2 going down. That would be potentially 4 seconds, unless they're going 1, 2, 1, 2. But you're counting for 2 seconds up, 1, 2, and counting 2 seconds down, 1, 2, right? So always talk to your client about slowing down their movements. Slow also helps to give them control, but it's going to help build muscle and strength. So again, that optimal duration for TUT is somewhere between 4 and 20 seconds per rep. The optimal duration for muscle growth, so for an entire set, so we talked about 1 rep, but the entire for an entire set, it's somewhere between 40 and 60 seconds, right? So if you are doing 10 to 12 rep range, so you could be doing 1, 2, 1, 2, but if you're doing 6, you're going to be going typically slow down, maybe a little quicker up, but you can see where for optimization, you'd really want to slow your movements down. So if you take longer than 60 seconds, then it's starting to get into more of that endurance range, right, than strength. So anywhere between 40 to 60 seconds is maximal. And by putting the muscle under longer bouts of strain, you can cause those micro tears, you have more extensive muscle breakdown, and that can lead to higher strength gains. So takeaway, don't rush through a movement, get them to slow it down, maybe 4 seconds, 5 seconds, 6 seconds per rep. And then, ultimately, if you can get them working 40 to 60 seconds in a set, they're going to see the most return. They're going to see the most hypertrophy. Any questions on that before we go on to the next slide? Slow and in control. All right, and one of the reasons is because when we go back and we take a look at in our sarcomeres at our actin and myosin, right? They do those cross bridge connections, and if it's too quick, they're not making the connection, and there's going to be less force and less results. So if you slow it down a little bit, they have a better connection, and you're going to get more strength. So you can tell them that. All right, so when we're creating these programs, these are all the major muscle groups that we want to train. You know, all the muscles we can see and on the front are vanity muscles, and then all of the muscles in the back. So we've got our quads, our hamstrings, our gastrocnemius and soleus, our trapezius and rhomboids in the back with latissimus dorsi. We've got our pectoralis major, chest muscle, our glute max, or gluteus maximus plus medius, our abdominals, erector spinae, our biceps brachii, our triceps brachii, and our deltoids. So all the major muscles we want to train. And for beginners, we want to do, you know, all the major muscle groups, pretty much full body workout each time, right? So we're going to be doing full body each time we're working with them. So most programs, we're going to do whole body programs 2 to 4 times per week. We're going to work first on muscular endurance and then gradually hypertrophy and strength. Right, so for beginners, whole body programs, so no split routines, right? They're not there yet. We're doing full body and all the major muscle groups 2 to 4 times per week. And that might be, you know, 1 time with you and 1 time on their own, or a couple times with you, 1 or 2 times on their own. You're going to put their program together. You're going to work on endurance first, remember, so they get the form and then gradually change the intensity. And then they're working more on hypertrophy or strength, depending on what their goals are. All right, so we've got, and you notice one thing we didn't really talk about was cardio in there. So primarily, if you're working with clients, the cardio that they get is at the beginning when they're doing their warm-up. You are still going to create, when you create their program, you're going to put something for cardio in there. It's just not with when they're training with you, right? But they should be doing some, how many minutes per week for moderate to vigorous cardiovascular activity?
150.
150, right? So you got to program that in. So when you're putting their program together, you know, don't forget that it's not necessarily everything that they're doing with you. It's also when they're not with you, what they should be doing, right? So make sure to add that cardio in. All right, so then we have after cardio, but oh, okay. Here's the other question. So we have cool down, but if you are teaching a group, should you do, so you do your warm up. Do we do cardio and then strength, or do we do strength and then cardio?
Cardio and then strength?
This is where I say it depends.
Oh,
So there's no hard and fast rule. Here's why. If the focus is to really do strength training, right? A lot of people say if you do cardio first, you tire some of these muscles out, and then you don't have as much energy to do your strength work. Make sense? So it depends on the focus. Now, with your clients, I mean, you could put, you know, they could do some cardio. Maybe they do 15 minutes of cardio. But if most of the time you're going to do your strength work first, and then if they want to go and do some cardio, they might walk on a treadmill or whatever, they can do that. Does that make sense? Hello? Anybody there?
sorry. Yeah.
Yeah, no, I just like it's a question that I get quite frequently, and it's like think about it always comes back to what the goals are, right?
Yeah. But Heather, I saw
Yeah.
something in the book that was saying like kind of the opposite, like we need to do the cardio first.
So you know in the book they train one way. She has her way of thinking. But again it comes down to the goal of the
Okay.
client. Yeah.
No,
So
I was like just worried like about the test.
yeah.
Like, oh, okay, what they're going to ask in the test.
If it was on the exam, I would tell you exactly like
Okay.
this is what you need to. Yeah.
Perfect.
So, but just for your own, you know, like your
Mhm.
thinking process as you're going forward, think about as you're structuring the program, what makes the most sense for my client, right?
Mhm.
If they are training to do some type of an endurance event, obviously cardio becomes a very important part of that program. If they're going for strength gains, then doing a whole bunch of cardio can be counterproductive,
Yeah.
right?
Okay, perfect.
So we have to really consider that. And then when is the appropriate time for them to actually do their cardio? And it may not even be in your session. Like I said, they may come and do an entire workout with you, and they are not doing cardio with you, but you can program them to have cardio that they do at a different time, right? They may come in at a different day, or they may do their walk or their jog or whatever they do when they're not with you, right? So, but if you do put cardio in the workout because, you know, they want to work on it, again, it comes back to, is their focus more for strength? Because then you might want to do your strength work first and then do cardio. There's no hard and fast rule,
Mhm.
right? But what we do want to make sure we do at the end of a workout is our cool down, right? So, and especially if you're doing a really, you know, if you do a really big workout or cardio, depending, doesn't matter which. Now, if you start with a whole bunch of cardio, they do 15 minutes cardio. Well, you want to do a little bit of cool down, which is going to sort of segue into your strength training, right? But if you did a whole bunch of strength training, you're probably still their elevated heart rate and everything. So we want to kind of cool them down, do some really good stretching, could be some light walking on the treadmill, a whole bunch, and then, you know, at the end, do your flexibility training, and then they're done. So making sure warm up in between, it depends on you and the client, whether that's including cardio, not including cardio, could just be resistance training the entire time. And then at the end, we want to make sure we're cooling down, doing our stretching. And as I mentioned, you still want to make sure they're including cardio in their program. It just might not be with you. All right. Make sense?
Yeah.
Quick question.
Sure.
I'm sure you've heard this many times. I'm just wondering if it's true. Does doing cardio right after hypertrophy training interfere with your gains?
I think it depends on the intensity. If you do you know, a really good workout and then you're just as a cool down, you're just walking on a treadmill, like it's just because you're helping to flush out maybe some of that lactic acid, and you know what I mean? But
Mhm.
if you're going crazy with the cardio afterwards, um I don't know. I'm not sure if it's going to take all of your gains, but it might eat into some of it. Because remember, when we mentioned earlier that muscular endurance and muscular strength are gained independent of each other. And then we also have cardiovascular endurance, which is different than muscular endurance, right? So I guess the thing is, if you're doing a really difficult training session and you also want to train for some cardio endurance, you're better off doing it at a different time.
Okay.
But also, if you're doing a lot of cardio endurance, think about long distance runners, right? They're very lean.
Mm-hmm.
Think about sprinters. They're very muscular and powerful. So depending on your goal, cardio endurance, like a heavy cardio endurance, doesn't really work well with muscular strength.
Right. So if you want to keep as much muscle as possible, but you want to work on your cardiovascular system, maybe just do like some sprint intervals or something a couple times a
Yeah,
week.
absolutely. Hit Tabatas, that type of thing can
Mm-hmm.
be really great. But if you're going for, like, you know, 10-kilometer runs,
Yeah.
you're good. Yeah. It's
Okay.
kind of you're working at opposite ends, I guess, if that
Right.
makes sense.
Okay. Thank you.
I actually have I do nutrition consults as well. And I have a client that is an endurance runner, but he wanted to gain muscle. And it's like, you kind of got to choose, right? Because you can't be doing marathons and think you're going to gain all this muscle weight. It's just not going to work, right? So, yeah. There is that. Okay. And then at the very end, we want to stretch. We want to stretch what we're strengthening. And we even said in between, like some of our active rest could be stretching, right? Because you can stretch as you go. If you're working lower body, you can in between do some really nice lower body stretches and then work upper body. You can do upper body stretches. So you can be kind of doing that as you go. Or you can do it at the end. You just want to make sure that you're getting those stretches in, right? So you want to stretch all those chronically tight muscles. And the nice thing about doing it at the end, though, does kind of transition your client from their kind of work time to now transitioning back into my regular life. So it's a nice transition. It's a mental relaxation. What kind of stretching are we doing at this point? Dynamic or static?
Static.
Static, exactly. When do we do dynamic?
The warm up.
In the warm up, right? And how long are we going to hold these stretches?
30 seconds or more.
Yeah, so well, at least 15 to 20, right? Longer can be better, but you kind of got to work up to that. Right. So at least 15 to 20 and then stretch longer if they can. And a lot of times, once they become accustomed to it, it's sometimes for some people holding a stretch for a longer period of time, almost like, a yoga stretch, you might be holding it for a minute, can be a lot. It's just a challenge for them, right? So they've got to work up to it, but at least 15 to 20, 30 is great. And then again, as I had mentioned, you want to use a training log. I have a template that I use that I write everybody's workouts down. Some trainers use their iPads or, some kind of a electronic pad that they write everything down. Just make sure you keep records. And again, it's because you want to be able to track clients' progress, from the beginning. And you want to, and if you don't track it, if you don't keep records, then how are you going to know, right? And also it'll jog your memory. I mean, if you're working with a number of clients and, you might see that person once a week or coming in, are you going to remember what weight they did last week, right? If you're seeing a number of clients in between, so you got to be able to write everything down, keep it. Plus, if say, for example, you can't come in that day and some other trainer's taking over, they have all of those records. They can look back and they know what the client's doing and they can continue on. So it's always good to keep records. All right, so we're going into program planning. How are we doing for time here? All right, we're doing great for time. And then you can see we've got, day 1, day 2, we've got it all planned out. And as I said, you might be working with them, maybe 1 or 2 days a week. And then the other days of the week, they need to have something to do. They might be coming in and doing a workout on their own. They might be doing some, cardio, some other sport, cross training or whatever, but it all should be captured in a workout plan. And these are things that you would talk with your client about before, you put the plan, ask them what it is they actually like to do. Oh, my fan didn't get plugged back in. All right. I'm getting warm in here. All right, so we're going to talk about some steps for designing a workout plan. Do you guys do your own workout plan? Do you create a plan for yourselves?
I don't.
Do you track your workouts?
No, I just kind of do chest one day, legs, and then back, and then all over the place. Whatever's not sore.
So it's a good idea to start and try doing it for yourself because you're going to be doing this for your clients. A couple of easy ways to do it. I either use a notebook, and I actually have a ton of these type of little ring binder notebooks that I've got workouts from like 10 years ago, and I write everything down. Everything that I did, all my weights, my sets, reps, and everything, I can go back and look. But now, rather than carry a book, because everybody has their phone, I actually just keep notes in my phone for all of my workouts. So I can go back and look to see what weight I did last time, how many reps, how many sets, and then, today do I feel like I want to challenge myself in any particular way, any muscle group. So always good to keep. So start as homework for yourself. because you're going to be doing this for your clients, I would recommend that you start keeping track of your workouts. I also recommend that you create your own workout program for yourself. And I am going to actually make a note, because when you guys come to on Saturday for your in-person day, I would like everybody to come with their own workout plan for themselves. All right, so here's your homework. I'm going to write it down, so I'm going to send it out. Is you are going to create your own workout plan for yourself.
I use an app called Strong,
Mm-hmm.
and yeah, I've been using it for a few years. So whenever I bring up an exercise, it'll tell me how much I did the last time for my warm up, for my working sets. And I can click on the history. It'll say what I lifted 2 years ago. Like
Mm-hmm.
my PRs, it'll estimate my 1 rep max and everything.
That's fantastic. And would you send me the link or what that app is, and we can share it with the group?
Sure.
Yeah. And so it's great. However you can tracking is what we want to do, right? It is tracking, but we want to step back from that. We want to create our program first, right? We have to know what we're tracking, right? So creating that program based on what your own goals are, right? So these are all things you're going to be going through with your client. You're going to be asking them all these things. So step back and think to yourself, what are the goals for my own workout program? Where do I want to get to? What do I want to work on? When do I want to get there? Think about all of those things, put them down, create a basic workout plan for yourself. All right. So, because you should be able to experience all of that if you're going to be doing this with your client, right? So, all right, steps for designing a workout program. Lots of work goes into designing this program. You can be your first client. So get to know your clients. And so with the initial consultation, oh, yes, I have the PARQ. So you guys know what the PARQ is, right? The Physical Activity Readiness Questionnaire for everyone.
Yep.
Does the rec use a PARQ? Do you know?
Yeah.
They do. Perfect. Wonderful. So when you're doing personal training consultations, especially, but if you're doing individual trainings one-on-one, I always recommend getting a PARQ. Do a PARQ with your client before you even do anything with them. And that's because if you find out during the PARQ that there's some issues that they can't proceed to train, right? You wouldn't have wasted all your time doing a huge intake form only to find out that, at the end of the day, they need medical clearance before they can work with you. So, if you have the opportunity, I highly recommend to do your PARQ first.
Just Judy said on Saturday, Sunday, about like some medical confidently, like we can't ask more for the PARQ because it's a medical record.
Yeah, so the PARQ, they can fill out the PARQ. So they're actually filling it out. So it's like a self-administered, they're reading the questions and they're filling yes or no. So you're only there if they need to clarify something, but it's a self-administered questionnaire. And then, those first 7 questions, if they answer yes to any of those, then they go on to the extended part and they answer those. And if it's still yes, then that's when they have to get their medical clearance, right? And I'm not sure exactly what Judy would have said, because I mean, as a maybe for AEL, the scope of practice is different, but for weight trainer, personal trainer, you can be asking, you can ask a lot of medical questions, and you really need to know
Okay.
the answers to some of those. So, yeah, depending on your scope of practice, I guess, right?
Okay.
Yeah. So some of the things you're going to talk, so I just recommend go right to the PARQ first. I mean, even as a group instructor, or if you've got people coming into the group, because, you don't want to put them on the floor and have them drop from having a heart event or something that you could have maybe predicted if they had have done the PARQ, right? So PARQ, right off the bat, saves you time and also is good, you know, if you're don't have to go on through all the intake and everything and then not be able to get a client out of it. But also it's so important for the client to understand, you know, if they have any issues, that's going to require them to get clearance before they go. And most of the time they're going to go to their doctor and the doctor's going to say, yes, please do exercise. It's great for you. But we just want to have that sign off from the doctor, and that releases us from any liability as trainers, right? All right, so some of the things you're going to ask for, you know, constantly, you're going to introduce yourself, learn their name. This is really important. I always write it down because I have the worst memory. Somebody could tell me their name, and 2 seconds later I've forgotten it. So write it down is really good. Make sure you spell their name correctly, right? And then, of course, just be yourself. You know, be approachable. Smile. You know, you're just like you're interacting with a friend or somebody that you know, because you want to make them feel comfortable and welcome, right? And then you can take them on a short tour of the facility and use their name frequently, because the more frequently you use their name, the more likely you're going to remember it. But also just the fact that you're using their name makes them feel more comfortable. You can show them around. I know you guys have, I just learned that today, is it MES? You have MESs at the rec? Or no, yeah, it's their customer experience, for like customer experience, or what's the acronym for that?
I don't know.
So so you have customer experience people, but I thought the acronym was like MES or something. It was a different acronym. Anyway, so you have people that are, you know, maybe behind the desk. You have other trainers. You have people that work around the facility. So if you're just showing them around, and you can always introduce them to a few of these people, right? Just to make them feel welcome and included. And then you're going to want to find a quiet place or a private place to do the intake forms. So why would you want to do that?
So they'll give you private information.
Yeah, exactly. Exactly. And because a lot of these intake forms have a lot of personal questions. And, you know, you want them to be answering truthfully and fully. And, you know, having other people around to listen to their answers might be really uncomfortable for them. So if you have a nice, quiet, private office you can go into, or a place that's private where you're not overheard, that's always the best thing, because they're going to be talking about a lot of these things. And then I had mentioned the PARQ, but really, before you even start, like, so you can take them through and make them welcome, but once you get them into the room, I would get them to go through that PARQ before they even started providing any additional information, just, you know, just in case. Oftentimes, by the time they've gotten to you, they're probably already pre-qualified, but just to be on the safe side. And then you're going to, you know, obtain their fitness histories. You're going to talk about what they've done in the past, you know, and then also, do they have any past, you know, injuries? What is their lifestyle like? Are they, you know, always at work? Are they sedentary when they're home? That kind of thing. And then you're going to key in on 1 or 2 important factors, that they really want to work on, right? Because we can't change everything right now, but maybe it's, oh, I want to lose some weight, or I want to, you know, gain strength. So that's what you're going to focus on. And then gradually, if there's other things they want to work on, once you've gotten some success with that, you can start adding other things. And what you'll find with a lot of people, they'll come in with one intended goal in mind. And then when they start seeing success, then they see more possibilities. And then it's like, oh, now I want to work on this, or I want to do that. And that's how you retain a client, especially if you've been tracking their progress, because you literally can show them. We're going to talk about, you know, how often or how frequently you should be doing reassessments, and, you know, doing these reassessments maybe every 6-8 weeks, or however often you program them in, and they really have the opportunity to see that progress, right? The other thing is too, you're going to explain, you know, there is some potential for injury. because nothing is without risk. And we know all kinds of things can happen on the gym floor or in the fitness room, that can create injury. So just that they're aware. And also, this is a great time to talk about even how sore they might get. Not that we want to make them afraid to come and show up for their workout, but hey, this is the reality. Especially if you haven't been doing, any work, any weight training related exercise for a while, you're probably going to get some sore muscles. You're going to be stiff, whatever, but that will pass. And just create, let them know, let them be aware of that, so there's no surprises. And then also how, you can mitigate some of that with making sure they get stretch and they're getting proper nutrition and they're getting lots of rest, right? So things that they can do. And then also, again, knowing your scope of practice and not going beyond it. And you do have a scope of practice in your curriculum, and you'll have a separate one for personal training when you get there as well. But, as long as you're staying in the boundaries in your scope of practice, you will be fine. And that goes also back to knowing when to refer out. All right. So what you're going to do, you're going to determine, once you've determined kind of what their fitness level is, that's going to help you plan the correct exercises, keep them safe, help them achieve their goals, find out, are they beginner, they're moderate, they're advanced. Most of the time, especially as you'll be new instructors, you're probably going to be working with a lot of beginners, which is great. I love working with beginners, and I'll tell you, one of the biggest reasons is they're so excited to do these exercises, and when they start to see progress, they're just over the moon, right? And I love to see that progression. So working with beginners is awesome. And then you're gonna use a whole bunch of questionnaires, probably depending on what your facility wants you to work with. And so at the rec, do they have questionnaires for the trainers to use?
Yeah, there's like a whole 4-page thing.
Yeah, and it asks sort of some medical questions and
Yeah,
yeah,
pretty much
yeah.
everything. If you have pain and like a picture of a body and you put X's where the pain is and
Beautiful. Actually, I'm going to ask Adrian if I can get a copy so I can see. So, well, we can maybe work with that a little bit on the weekend. And then just, getting comfortable asking people about these questions, because sometimes some of these questions can be really personal. And just, getting comfortable with asking people about that. And then making sure to ask open-ended questions. What's an open-ended question?
One
They
that's
can't-
not yes or no.
One that's not yes or no, that's right. So it's like, do you like fish? Yes, no, right? But if you were to prepare fish, what way would you prepare it? So just asking the question in a way that helps them to open up, right? And that's what you want to do. One of the things I find, and it's especially important when you're building rapport with a client, if you are constantly asking them yes or no questions, there's no chance for that dialogue or interaction, and you're not creating that bond. But if you are asking open-ended questions and you appear like you're really interested in the answer and you're keeping that dialogue going, that's how you build the rapport. And the rapport is really important to keeping clients, right? So open-ended questions are great. So you can do a bunch of different things to help assess your client. And one of the reasons, obviously, we want to determine their fitness level and their exercise readiness because it determines the starting point. Going back to, we want to start where they're at, right? And then we're going to have them set some realistic goals. And what kind of goals are we going to work? What kind of goals are we encouraging them to set?
SMART
Smart.
goals.
SMART goals, that's right. What does that stand for? S.
Specific.
Yeah, M.
Measurable. Oh,
M is
measurable.
measurable. A,
attainable.
attainable. R,
Relevant.
relevant. And T,
Time.
time bound. That's right. So if you can get the goals kind of fitting within there, and then you're able to, once you've gotten those goals, then you actually can track progress because you've got some benchmarks to measure against. All right. Perfect. All right, so what kind of appraisals can you guys do? What kind of things can you do? Can you do measurements?
Yeah, blood pressure.
Yeah, we can do blood pressure. We can do resting heart rate, right? Do you guys have a blood pressure machine at the rec or
Yeah, we were using it there last week, and
beautiful?
I don't know what it's called, where you step on it, does your body fat and everything. Not, it wasn't accurate though, but
For blood pressure, for step on like in body, like it does
kinda like body mass and body fat
body mass
percentage.
index. Yeah. Yeah.
Yeah.
It gives you, you know what? So a lot of the equipment may not be accurate, but it kind of directionally gives you a starting point, and it's kind of directionally if you can see some improvements. But blood pressure you can definitely do. You can figure the resting heart rate, and oftentimes it'll give that, or they can provide that to you. So you can let them know, hey, take your blood pressure, whatever, first thing in the morning. And if they have any of those wearables, they probably already have that information. You can do girth measurements. So what was the concerning measurement for men over how many inches around the waist?
50?
40. 40.
40, yeah. And what about for women?
35.
35, yeah. And why do we say that is concerning? What does it put them at risk for? Be some chronic diseases like diabetes or heart disease, right? So if they have higher girth measurements, typically that means they have more adipose tissue in the abdomen, right? And that is essentially they have a lot of fat around the belly, and that can raise their risk for diabetes or heart disease, right? And that's why we do the girth measurements in addition to BMI, right? So because we know that with BMI, you can get somebody who's very overweight and not in shape at all, and somebody who's very muscular, and they can have a similar BMI. But when you do the waist measurement, right, waist to hip or just even a waist measurement, that can help you get a clearer picture. And then we can also calculate their exercise heart rate training zone, right? So you can do the Carbonin method. You can do, so if it's individual, I would recommend doing the Carbonin method, because that's going to give you the most accurate individualized heart rate training zone. And then you can do other methods that your facility might do and train you in, right? You can do movement patterns. You can get them to do squats. And what are we looking for, when you're doing squats? Maybe are their knees going in or their knees going out? And then we're going to look to see, okay, what muscles are imbalanced and what do we need to work on, right? Get them to do lunges if they can. If they can't, then okay, we already have some issues with some muscles that are weak. You can get them to do now, depending on their age and ability, right? Could be doing some push-ups and working some core. So you can do assessments with movement patterns for sure. And then remember always to stay within your scope of practice. And if you don't feel comfortable doing these when you first start, get some help from another evaluator that maybe has some more experience. You guys are really lucky to have Adrian there as a mentor. So at the rec. But for others that are not part of the rec group, if you have somebody at a facility that you're working at that you can, ask for assistance or help sometimes, or to get to mentor, it's wonderful if you can work with another trainer that has the experience. All right. So when you're, you're helping your clients to set goals, remember goal setting is really important. asking those open-ended questions, setting short and long-term goals. Why would we set short-term goals?
Get them excited early, get them bought in.
Exactly. Some milestones that they can just check off, right? Because sometimes those long-term goals can seem so far away and they may start to lose motivation. But if you set some short-term goals and they're seeing those results really quickly, exactly to your point, they're excited, they're motivated, they want to keep going. So it's good to have both. Also find out their interests, right? Their likes and their dislikes. Because when you're putting your program together for them, and if they don't like doing, if they don't like running, are you going to put running into their program?
Maybe a little bit. Depends on
You
why they
have to
don't.
run. You have to run. Well, you know what? You could probably find some other exercises that might give them the same results, but don't involve running. So, maybe they just find it really boring. Maybe put them on a bike. Put them, get them doing something else, right? Find out what they enjoy doing. And then add more of that in. Now, if there's some things that you really recommend they do because of the goals that they want to get, and it's not something they love, maybe that you give them some type of extrinsic motivation, right? Until they decide that maybe this is something they enjoy because it's giving them some benefit. And then it's more intrinsic, right? So sometimes we use those little rewards and things extrinsically to get them motivated to do something that they may not love at the very beginning, but then hopefully gradually it just becomes the reward just doing it. So that's where that motivation comes in, right? And then put some types of exercises, ask them what they like doing. And then set a realistic time, reevaluate regularly. So typically when you put a program together and you put it in phases, so they might do that program for 6 to 8 weeks, and then you're going to want to set a reassessment time. So you're going to get them to come in, kind of go through everything and then see where you may want to change some of the exercises, increase some of the intensities. So you're evaluating regularly, on a schedule. It's also the opportunity, again, it comes back to the client's going to see how much they've progressed. It's like, gee, remember when you first started coming here 6 weeks ago and you're only lifting 5 pounds and now you're lifting 10 pounds? Wow, like 6 weeks, that's wonderful. And they're just going to feel so great that they've accomplished this. You're building that rapport, right? And that's how you keep a client motivated and staying with you. The really good trainers, they know how to motivate and get their clients excited, right? And they build that rapport, and that's what's going to get people coming back, that they're going to keep going with you. They're not going to just do a 10 pack of sessions and then peace out somewhere. They're going to want to stay and work with you because you are showing them that you're getting them results. That's why they're coming to you. All right. And then again, keeping that a record of progress, their journal or their workout card, figure out some kind of way that you're going to keep records. The other thing when we want to mention about records, you want to keep records, anything that's personal to the client. If you have forms, should be in a locked, like something that's locked. If it's on your computer, it should be encrypted or, password protected. If it's forms that you have in your facility, hopefully they have a locked office and even a locked set of drawers for keeping files, because that's all personal information and you want to, make sure it stays private and personal. All right, and this could be just an example of a workout log. So this is an upper body workout log. You have all of their exercises in here, their sets. So there's a place to write down their what they do for weights and how many reps that they would do there. You can put in some notes for them, tempo count 4 down, 2 up. You can also give them some other variations. And then down here, you've got, here's your warm up, and then you want to do some windmills. So you're warming up the upper body, stretch through the chest and back and triceps, and then so just giving them some further instructions, right? So this could be for when they are working on their own and not with you. All right, and when you are speaking with your clients, and I know Adrian does coaching, and he's probably talked to you about this, but when you are coaching somebody, now you might be asking them some questions because you need to know the information, but listen to what they're saying. So speak less, listen more. In actual coaching, the client is doing about 70 to 80% of the talking, and the coach about 20 or 30%. So even as a trainer, you're asking questions to get information. Ask your question and then let them talk, right? Listen to what they're telling you. So when they are telling you and you're listening, if they're using words like, I want to tone, I want to lose weight, I want to firm up, I want more energy, I'm just looking for overall general fitness. What you should be thinking is, I'm going to look at creating a program that's more endurance-based. Because for those types of goals, an endurance-based program works very well. So if they want to lose weight, starting off with more reps, lighter weights for toning, endurance is the way to go. Now, you don't have to do like 2-pound dumbbells and 20 reps. You can still do some decent weights, but we're going to probably be in that 50, 60, maybe up to 70% of our 1 rep max, and just doing more reps. Okay, and then if you hear them say things like, I'm interested in bodybuilding, I want to build some muscle, I want some gains, right? I want shape. They're talking more language about hypertrophy, about muscle building. So we're going to think about building a program that's more around hypertrophy. So we're working reps that are maybe 8 to 12, right? We're working at that moderate to more moderate intense weight. So maybe 70 to 85% of our 1 rep max. And then if they're saying, I'm powerlifting, I'm doing sports performance, that type of thing, and they're working more, they're probably looking more for strength. So we're going to be probably looking at more heavy weights, closer to the 1 rep max. And the way that you structure their program is going to be different. It might be more split routines, that kind of thing. So listen to what they're saying, right? And then once you get those cues, you can ask more questions, but you're going to start to think about, how am I going to develop the program? It's going to be based on what they're telling me, right? So because it is their program.
I have a question, Heather.
Sure.
So one of the things that has come up, a lot, that they always say to do weight training for bone density. So is endurance enough, or does it have to be hypertrophy?
You want to build when you're starting with, so for bone density now, it depends on the person and if they have a pre-existing issue. Like if they already have osteoporosis, you have to be very careful as you're doing your resistance training, like you're building on their base, right? You're gradually building their strength. So you're going to be probably more in the endurance range for that, but you can get them into hypertrophy, and you can even get them into strength depending on the person. So if they're concerned about bone density, again, we're meeting them where they're at. And if they're just starting off, for every beginner, you're pretty much in that endurance range. And then you're gradually going to guide them depending on where they want to go. Does that answer your question?
I mean, I know that they have to start off,
Yeah.
with kind of endurance part, but like, I thought it was the more stress that you would put on the bone, the greater density.
Yeah, but there's kind of a risk benefit there. So you can gradually get them up, and I mean they can be during, because remember for hypertrophy, you can be anywhere between 8 reps to 12 reps, right? So and they could be working their 70 or 80% of their 1 rep max. So yes, you can absolutely do some heavier weight, but you're probably wouldn't take them beyond that, depending on where they are. So if they're if depends if they already have a risk of brittle bones. Obviously, you're going to have to be very cautious. Depends on their age, their ability. I mean, there's so many factors, but we know that resistance training is fantastic for strengthening bone, and also because it also strengthens all the muscles around the joints and the bone. It makes the entire body stronger. And also, what else would we work on if they were concerned about their bone density?
Well, you might want to do like stuff like flexibility and balance just to make sure that you don't fall down.
Bingo, exactly. Because exactly. Because that's one of their other key things is the risk for falling, right? So as much as we want to work with strength to build their bone, we also want to build flexibility and balance. So it's kind of an overall program. But again, it comes back to the individual and starting with endurance and then gradually build as their capacity allows. Because obviously the stronger they get, probably they are strengthening their bones. And then there's other things that are going into that as well, like is their nutrition on point? Right? There's all kinds of different things that factor into that. So it's really hard to answer sometimes definitively because there's so many variables, and I hope that you're getting that out of my answers. There's so many variables. It comes down to the individual. So in principle, we know that resistance training is fantastic for for helping for bone strength, but every individual is different, and where we start with them and where we are able to take them depends on their ability, where they're at, what their bone density scores are, what their risk factor is. There's so many different things to go. So I hope that answers your question. And I think as we progress more with the personal training and as you do some more research, you'll probably learn even more about, if that's an area that you're interested in, working with people that have issues with bone density. There's lots of different training options that you can do.
Okay, thanks.
All right. All right, so we did this, we'll keep going. So, and then we're going to ask a specific question. So when we're setting our goals, who's involved? And when I say who is involved, it could be, are you training with a trainer, or am I creating this program that you're going to implement yourself? Are you doing it? Are you working with a group? Do you have a support group? That type of thing. So who is involved with them as they're doing their program? What is it that they want to accomplish? Where are they going to work out? What's the location? Are they going to be coming to the gym? Are they doing it off-site somewhere? Are they just doing it out of their home? When will they work out? What the requirements are, if they have any constraints. Do they have time constraints? I can only work out at 6 a.m. because I can't work out at night. I've got the kids, blah, 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 right? So there's what works in their lifestyle. And then their why. And we don't have a lot of time to go into the whole concept of the why, but it all does come back to motivation. If you can understand from your client what makes these goals so important to them, what's going to be different in their life if they accomplish it, what are they going to think or feel, and what are they going to see? What are other people going to see about them when they've accomplished these goals? If you can get them to visualize that, if you can get to really understand why it's important to them, whether it's because they feel they'll be a better parent because they'll have more energy to spend time with their kids. So if you can go back to their values and tie that goal into their values, that's really going to help with their motivation, especially when things get tough for them. So the why can be one of the most important understandings that you can have with your client. So, the purpose, and then you can tie that all back to what their goals are, and that keeps them motivated, especially when times get tough. All right, and we're going to talk about measurables. So just making sure, I think we've gone through the SMART goals. I think you guys have a pretty good idea of how they all work, but you want to make sure you're quantifying things. So, it shouldn't be vague, like I just want to get in shape. It's like, I'd like to lose a certain amount of weight, or I want to be able to do, lift this amount of weight. They need to have something that you can quantify, right? So that you can measure it. And then they'll know, like, so then you need to understand also, how are they going to know when they've accomplished it? So if their goal is to, gain more muscle, what does that look like? How will they know they've gotten there? And then you want to make sure that they are important to, they are important to the person, and that they're their goals and not your goals for them. Not like, oh, I'd like to lose weight. Oh, well, then you have to do this, 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 and this, right? So that becomes the coach or the trainer's goals, not the person's goals. And then, so, developing the goals that are important to them, how to, do they have the attitude? Do they have the ability, the skills? Do they have the money? Because it does cost money to get trained, right? So, maybe it's that they can only afford to come with you once a week, and the rest of the time they do things on their own. Or maybe they can only, have so many sessions with you, so you plan it out so that they come back and you're just doing check-ins, right? So, and also whether it's within their means. And so realistic, is it realistic I'm going to lose 20 pounds in a week? No. Right? Can I lose 20 pounds in a month? That's probably really tight too. Like usually, what we say safe weight loss is 1 to 2 pounds a week. So you got to set a realistic, realistic goals with them. If they're unrealistic, you're just setting your clients up for failure. And then the other thing is to enjoy the journey. So that's the nice thing about if you went back to, we're setting these short-term goals, that kind of gives them some little milestones to look forward to, but also that they understand, yeah, it would be fabulous when they reach their goal, when they're their overreaching goal, that big goal at the end. But wow, to enjoy the journey along the way and all of the things they've learned and everything that they've accomplished and how far they've come. If they can learn to enjoy the journey, then that is actually the that's going to keep them going, and they're going to learn so much from it. And when they do eventually reach their goal, then it's going to be a lot easier for them to maintain if they're able to enjoy the journey along the way, because it's easier for them to keep it up. All right, and then time bound must have an end date for the goal. Yep, it can't be someday. It has to have a set end. So that's where we come in with the T for the SMART goal. And again, they set milestones along the way. So when you're determining a training schedule, so when you're putting their program together, it has to fit the client's needs. And I mentioned quickly when I said, they can only come in at 6 a.m. because, they have a family and it's the only time they can get away to do their training. So the schedule has to fit the client's needs. It needs to be realistic. And that considers the time of day that they're doing it. Some people, they have more energy in the morning. So maybe a workout, if they're able to work out in the morning, is better for them than later in the evening. But again, it comes down to what their schedule allows, what the frequency will be. And that again is determined by the type of program you're going to do. If it's endurance, they might be doing 4 to 6 times a week, and they don't need as much downtime in between, because we know that endurance type workouts are not as strenuous, and they may require maybe a day, right, to recover. So frequency, days per week, what days you're going to be working out, And then the duration. So that's just like, is it an hour workout? Is it a 45-minute workout? Maybe they only have half an hour to come in and do some cardio on some days. So you can, work all that out with the client as you're building out their program. Normally, if you're working with the client, so if you're actually doing the work or training them, most of the sessions are going to be an hour. And that includes all your instructional times and the time for questions. And that's why if they want to get the best value, for example, once you've worked with them for a little bit, they should be able to warm up on their own, right? So by the time, if they're going to come work with you for 9 o'clock, they should be in the gym and maybe on that piece of equipment by 8:45 to 9, 10 to 9, getting warmed up so that when 9 o'clock comes, they're all warmed up and they're ready to go, right? So that's what it would be great to get your client to, because then you're going to have more time to work with them throughout that hour. And when you're creating your programs, you're going to determine the muscles to be trained. So again, it comes back to their goals, but we're also, when we're doing that assessment, right? What are we seeing when we look at the posture? So when you look at this person here, and maybe it's somebody that's on their computer all the time, right? And they're always hunched over. So what are we seeing here? Their pecs are probably going to be really tight, right? But then we're going to have some weakness in the back, in their rhomboids. So their shoulder blades are going to be protracted, right? Instead of be able to retract. And then our middle trapezius, so our trapezius muscles. Our upper traps are going to maybe tight. We have some weak, deep neck flexors. So we've got that round-shouldered syndrome, right? So before we put any weight and start working chest muscles, because we know they're already tight, we're going to want to strengthen their back. We're going to work on posture. So we're going to try to work on those imbalances before we start to put, a whole bunch of weight. So, and you need to be able to explain that to a client while you're not taking them right to, oh, we're going to do all kinds of chest presses. We're doing all this. We need to, strengthen these muscles that are weak, stretch out these muscles that are tight, get us into a better posture before we start putting weight in their hand. Make sense? And that's where it becomes really important to understand what each of these muscles do and what are the opposites, so that we can start creating programs to correct those imbalances. And here's where we see, you want to determine the muscles to be trained. So if you're finding that, for example, our quadriceps are strong or tight, usually that means maybe the hamstrings are a little weak. So we're going to work on creating some programs that are going to strengthen our hamstrings. And then if we know that they're sitting all the time and their iliopsoas is probably, we can surmise that the iliopsoas is probably going to be tight, and we want to stretch that out and strengthen the glute max, because that's our hip extender, powerful hip extender, whereas this is a hip flexor, so they're opposite. So it's important to understand the muscles that are opposite to one another so that you can help to work them. All right. And I think this is in your book as well. Any questions on this? But as you're going through, when you do your assessment, it's very important to understand the relationship between these muscles, because that helps you to create your exercises in your programs. And then we're going to, again, when we're creating a program, we're going to create one that does all the major muscle groups, our legs, all the muscles in the legs, muscles in the back, muscles in the chest, and then a bunch of the smaller muscles. So this is for a full body workout. Typically, And we also want to and work core, and then we want to think about multi-joint and single joint exercises. So what's the difference between a multi-joint exercise and a single joint exercise? And give me an example.
Squat would be multi-joint, curl would be single joint.
Yeah, yeah, so exactly. And typically, do we do multi-joint exercises first or single?
Multi-joint first.
Multi-joint first, and then the single or isolation exercises, exactly. Do we do large muscles first or small muscles?
Large.
Large.
Large muscles, yeah. And I typically start, if I'm doing a full body workout, I'll typically start with the legs and I work my way up. Because our smallest muscles are typically our shoulders and arms. And if we work those first, they get tired for everything else we do. So working the legs, big muscles, big rewards, work the legs first. Back or chest, doesn't matter really which. And then some of the smaller muscles, shoulders and arms. And then core. So, you can finish off doing core. You can be on the floor doing some core exercises, and then that works really well going right into your stretch because they're already down on the mat. So great, it's that this is kind of the way I work with clients, but you can find out what works, for you. And again, it depends. I mean, you might have this all laid out and then some of the equipment you want to use is not available. And so you have to kind of change up your exercise session. But I do find this does work very well. The other thing that I typically do too is when I get up to the smaller muscles, like one day I might work arms and then the other day I work shoulders. So I don't necessarily do them both in the same workout, mostly because you tend to run out of time, right? So you can only do so much. So one day I might work, biceps and triceps, and another day work the delts. And then for core, you can have a number of different exercises that you can work to work the TVA or work your obliques, work your rectus abdominis. So, and then also your spinal erectors, your erector spinning. So you can vary some of these exercises here. And the nice thing about doing that is that you get, people don't get tired of doing the same thing all the same time, but we're still hitting the same muscles. So you can have some, even though you create a program that's 6 or 8 weeks for 6 or 8 weeks, if they're coming a couple of times a week, you can do, one exercise, one program one day and then have a second program that targets the same muscles even the second day, but maybe with different exercises. So it kind of keeps it a little fresh and hits the muscles in a different way and they can enjoy it. So you can stick with the same program, mix it up a little bit. Really depends on the person. Some people really enjoy having something different, some different exercises, and some people like to focus on the exercises they're doing and they really want to get good at it. So again, it depends on your client. And then we got 5 minutes, so we'll go quick here. So warm up just quickly. Why do we warm up? What were those things we were doing again? What's happening with the heart rate?
Increase.
Up.
Our rate's going up, we're warming our muscles, we're getting that synovial fluid going, right? So for warm up, you guys, as I said, you have your choice, right? So you can do your cardio. Hold on. Sorry, you can do cardio, so you can get them to do some time on a treadmill or a bike or elliptical, whatever, just getting their muscles nice and warm. And it could be anywhere between 5 to 10 minutes, depending on the weather, how cool it is, how that type of thing. Or you can go to, again, doing their warm-up weight, right? And work from there. So you do have a choice. And then lots of training variables, your exercises, ability, their time constraints or goals, the type of equipment that you have available to use, what they like or dislike, if they've had any past injuries that you have to consider. If they have any of those imbalances that we talked about before, we need to correct, right? what their personal motivation is. And, you know, I put partners in here. Anybody ever partner train?
I've taught some like really small classes that were usually 2 or 3 people.
Mm-hmm.
Um, kind
Have
of
you ever
interesting.
trained with a partner?
Yeah, I have.
Do you enjoy it?
Yeah, a lot.
Yeah,
Makes
and you
all the
know,
difference.
sometimes people do really well with a partner. It does a couple of things. One is if, you know, if you're allowed to do this in facility, and most facilities will, if you have clients that, you know, first of all, if they can't maybe afford a personal trainer, or maybe it makes it more affordable if they train with a partner, right? You want to make sure that they have similar abilities, right? You don't want to have somebody that's really good and somebody that's just a beginner, and that balance doesn't work, that dynamic doesn't work. But if they're fairly close, it can work very well. It keeps people accountable, right? Because they know somebody else is relying on them to come. Sometimes there's that little competition, even though they say they're not competing. But it can create a really great dynamic and, you know, be very motivating for some clients. Some clients just love to have the single attention, and, you know, that works for them. Some people like the partner, and some people like small groups. So you can, you know, maybe offer different services and see what works best for people. And what works best for you. Sometimes trainers really enjoy working with small groups. All right. And then, you know, when you're putting together your program, this is going to be our last slide because we're 2 minutes away. But some of the things you need to think about is what equipment is available for you. You know, what do you have available? Now, if you're working in a gym, you've got probably lots of machines, and then they've got lots of free weights and, you know, bands and BOSUs and kettlebells and all kinds of things. So you are unlimited pretty much for what you can put together in a program. But if you're doing your own services, if you're, you know, have private clientele, you might be working from a home gym that you've built, or maybe you're doing mobile service. You know, you have to limit obviously to the equipment that you're able to either have at your own home, or you know, able to carry with you in your mobile services. So that's when you need to get very creative. And also, you know, what is appropriate for the client to use? And then what do you know how to use? So if you shouldn't be working with equipment that you don't feel confident to use, like training people on kettlebells if you don't know how to use it themselves or do a proper swing, for example. So anything that you do use with a client, you should have some proficiency in using and feel confident in being able to demonstrate it and use the correct form. And then also what the client likes to use. So kind of getting again back to, you know, what they like and dislike, and trying to incorporate as much as they enjoy, because as we all know, the more enjoyable something is, the more likely we're going to want to do it, right? So we are going to end there. On Wednesday, when we come back, I'm going to be powering through the remainder of the slides that I feel that are important for you guys to know for the exam. And then we are going to do a review at the end. So we'll probably spend at least half an hour, if not more, on doing a review, going through some practice questions so that you'll feel really confident when you go in through for the exam on Saturday. So that is it for tonight. I appreciate your time. I know it's a lot. So, but if you do have any questions, please let me know, and you know, you can say afterwards or email me. And otherwise, I will see everybody on Wednesday. And yeah, enjoy the rest of your evening.
Thank you.
Thank you so
Alright.
much. Bye,
Bye.
guys.
Bye-bye.
Bye.